Welcome, everybody, to this week's Save My Piggies. We have a special guest that we will be getting to shortly, who is a courageous individual with peripheral arterial disease and is definitely a fighter. Save My Piggies is sponsored by Reflow Medical and brought to you by the Global PAD Association. Miss Kimberly, welcome to Save My
Hello,
Piggies.
hello. Love this. These are always my favorite episodes because I think healthcare is always about patients and patients are people. And it's really important for people who want to create the change they want to see in healthcare to share their stories courageously. So I'm so excited to have Susan Yates with us today.
It never is lost on me. The reason why you and I partnered, obviously you're a fierce patient advocate. I try to be as well. And in 2025, it's still amazing that patients can come in and see a physician with what we call claudication or stable peripheral arterial disease that may or may not even need to be worked on, honestly, but ultimately potentially have a procedure, complications ensue, and now have an amputation. In fact, I just got off a call with a colleague of mine who obviously I won't name his name, but he was telling me a story. Patient came to his hospital after that exact thing happened, and now the patient is going on hospice because they probably didn't need the procedure in the first place. Complications ensued, and now they're elderly but going on hospice. So I love the opportunity, and I again thank you, Kim, for the opportunity to allow us to do a Save My Piggies. And again, we got it right here. Well, it's backwards, but your life, your
It's
limb, your
your life,
story.
your limb, your story. I love it. And I had a similar story just today. And one of my biggest pet peeves is if a situation is not acute, why are you going in and doing any sort of procedure, whether it's endovascular or surgical, to restore blood flow if you don't understand the risk factors, if you don't know what's blocking the arteries in the first place?
Yeah.
There's no explanation like high cholesterol or high blood pressure, why are you going in to potentially poke the beehive with someone that might have a serious clotting situation? The patient that just contacted me today doesn't even know if they have one. All they know is literally within a couple weeks after the procedure, she blocked right back up, and the doctor said, "There's nothing more I can do. Good luck. Go home. When you have too much pain, come back and we'll amputate." And that is so sad. I think we have it on both spectrums where you have too many procedures to try to restore blood flow too early, but then there's still too many amputations without doing anything. More than 60% of all amputations that are being performed are no one's even trying at all in the year prior to amputation to do anything about it. And 90% of which aren't even getting vascular evaluations at all. So we have issues on both ends of the spectrum. And that is very disconcerting that
And
that is still a problem.
again, we need to get to Susan here quickly, but I just left a patient's room prior to being on the previous call with that colleague, and that patient, unfortunately, recently had a major amputation on the left side. He has had a stroke. He's bedbound. Now he needs an amputation on the other leg. And frankly, that's tantamount to a death sentence. There's nothing that I can do. The horse is out of the barn. So part of the Save My Piggies movement is also being proactive and raising awareness for people in their 30s and 40s who are at risk for peripheral arterial disease to try to see if we can recede this tidal wave here and allow them to have a more fruitful life.
And you know what would solve all of our problems is early, early, early diagnosis. And that's why the ARC Act, I just heard from the Cardiovascular Coalition that they are rekindling the ARC Act. When unfortunately, rest in peace, Senator Payne died,
Mhm.
the ARC Act kind of went along with him. And someone else I hear has actually picked it back up, and they're starting the movement towards bringing that forward to Congress. And that would make testing for all people who have high risk factors for PAD, high cholesterol, high blood pressure, diabetes, smoker, former smoker, all of the
Right.
above covered for early testing. And I think that that would be so huge because there's so much patients can do to stall progression of PAD. And that's where Susan comes in. She's actually a nurse And even in being a clinician, she still couldn't expedite a diagnosis for her leg pain for about 2 years. And I imagine if she was diagnosed 2 years prior, when she first started getting kind of the idea that something is wrong. But 2 years later, as this disease continues to advance, with risk factors not being mitigated and no treatment along the way, you can
Yeah.
imagine that she was a toe step away from amputation by the time she was diagnosed. So, what do you say? I think we bring Susan in. She's sitting back and she's letting
Yes.
us
Yes.
just
Welcome.
I,
Welcome,
I'm
Susan.
yammering
here.
on.
The
Hi,
thing that,
Susan.
hi, hello to everyone. The thing that gets me to show up for this and is that I'm sort of becoming a like, oh my God, why isn't this being checked? I was sent to every doctor under the sun before I ever saw a vascular doctor. No one even mentioned that that could be a problem. We went
What were
back
your
to my,
symptoms?
I had pain in my thigh that kept me from moving my leg forward on a regular walk. I ended up taking smaller steps to the point where when I was going in for surgery, I was almost dragging it. I had no flow. It turned out I was 90% occluded in my, this is where I'm losing my words because I keep forgetting things. Iliac
Oh, yeah.
The
Yep.
iliac.
artery
Mhm.
was 90% occluded by the time I got to the vascular doctor. And they found it, they knew exactly where it was. And so when I went in, he said, we're 50-50. We might be able to put in a stent, or I may have to do a bypass. We're going to see once we're in there and see what is the best thing to do. And I got a stent. And so far, it's working beautifully. I'm only a month out, but now I walk like a real person.
So, Susan,
And
Susan,
yes,
if I may interrupt, because I'd like to create a little context to your story. You're a nurse, correct?
yes.
So obviously you have the vernacular. You understand the healthcare system, um, and do you have risk factors for peripheral arterial?
Actually, very few. That's the problem. I had really bad pneumonia in April. And then post the pneumonia, I could not get my breathing right. So they sent me in. Everyone got worried about my inability to breathe very well, and so they sent me to the hospital. And I went into the through the emergency room and ended up getting a heart cath
Yeah.
because they thought that was the source, and I had nothing. My major arteries were clean, and there's some smutch in the auxiliaries, but nothing great, nothing to write home about. And so that was great news. And then eventually, over time, my breathing, it just took me much longer to get back to normal breathing than they thought I should post pneumonia. But once we knew that, I already had the leg thing, and I remember saying to them in there, I wonder what's wrong with my legs. And they went, well, you'll have to see somebody else by. I saw my spinal doctor because I thought maybe that was it. I went for a checkup on my for neuropathy. Maybe it's in your feet. I bounced from physician to physician.
Did anyone ever examine your pulses, though? That's usually
No,
the
not until I got to a vascular doctor. And I never thought of doing it either personally. Or I've got enough nurse friends that could have done it for me, and I never even occurred to me. But it was when I went to the vascular doctor, and he looked at my feet and he said, let's take a look. And he goes, nope, first thing, and sent me right away for testing. I
yeah.
had no pulse in my right foot, excuse me.
Yeah.
And it's just, go ahead.
No, I just gave a lecture to our residents, and I harped on them, examine the patient. The patient, you know, there's a quote from a French philosopher, I'm blanking on his name, but it's kind of like, you know, the eye sees what the mind knows. So you need to know that this is a distinct possibility in a patient, peripheral arterial disease. Examine the patient, listen to them. They will tell you what's wrong with them, and then you can diagnose them and treat them.
No one touched my legs or feet except for the guy who did the neuropathy thing. And he was the one that sent me to vascular because he was the one who was working on my legs and feet. And I think he noticed that I didn't have a pulse, but it wasn't his room to, his thing to say. But he noticed enough to say, you need to see a vascular doctor. And that's where I went next. And son of a gun, here we are.
Yeah.
And what was the timeline for all of this? Was it really 2 years? All of this
I started asking
exploration?
my primary care 2 years ago about this pain in my leg and the feeling that I was running out of energy in my leg, is the way I put it. And they all thought that I have fibromyalgia. That's my other problem. And I just sort of tend to plow forward. It doesn't really matter what's wrong. I don't stop. And so chalked it off to fibromyalgia. And then finally, I sort of got tired of primary care sort of blowing me off, which is really what happened. Yeah. And that's, I found, and I said, well, I'm going to get a new spinal doctor. So I found a new spinal doctor, and he turned out to be lovely. And he said, it's not your spine. They did all my tests, and they said, I don't see anything here for me to operate on, but I do see that you have problems, but nothing surgical, nothing that should be causing the pain that you're telling me about. And so he set me up for the other doctors, not the vascular one, but the other doctors, and the one doctor who sent me to the vascular doctor. And at least, he got me started on the road to find out what was wrong, where everybody else just said, oh, it's this, oh, it's that. Don't worry, you'll be fine. Take Tylenol.
I'm curious from Dr. Phillips' standpoint, and even you as a clinician, Susan, that I'm wondering, since you didn't use the buzzwords of leg cramps, that maybe you're exactly. And that's where I wonder where, for example, that a lot of women, especially their heart issues, are gone unnoticed because it's, angina, fatigue is really the new angina, is the way one interventional cardiologist explained it to me, Dr. Parag Doshi out of Chicago. He was like, I no longer just listen for angina. I listen for fatigue and what someone could do today versus, let's say, even yesterday or a year or two prior. And so I see, Dr. Phillips, you're nodding. What are your thoughts?
Yeah. So I always tell people as patients, like, not everybody reads our textbook. Not everybody comes to me and says, oh, I've got crushing chest pain that occurs with exertion that gets better with rest. Nor do people come and say, my legs hurt, my calves tighten up when I walk, they get better when I rest. Now, a lot of people, if you can tease that out of them, and we have ways of testing and ruling in blockages in the arteries versus, something musculoskeletal and things of that nature. But again, it's looking for risk factors. It's examining the patient. I imagine, Susan, if you I put my hands on your pulses, they're going to be abnormal, or the one side was going to be abnormal. So it's pretty simple, but yet the devil's in the details, and it's often overlooked.
Yeah. My complaint was that I felt in my right leg like I had run a marathon.
Mm-hmm.
The muscle was screaming at me, even when I walked in the end, a very short distance. But that's the thing, that I'd be walking uphill and it's like, oh my God, this is ridiculous. I can't walk up this hill.
Yeah, and you're exactly right.
Would do me in, and it was I used to run when I was younger, and it was how I would feel at the end of 5 miles. My muscles were saying, oh, we're tired and achy and getting very tense. And you were sort of pushing yourself through. And we did a lot of hills and stuff, because I didn't run on the road. I ran up and down in the mountains and things. I did the shorter mountain runs. And that's how I would feel at the end. And this is what this muscle felt like with a very short walk.
Susan, you touched on something very interesting. The vast majority of patients have their symptoms with hills or incline, and it's
Yep.
typically not too bad. Now, some of them will say when they walk on a hard surface for whatever reason, but walking on a flat surface, they're usually okay. The hill and the incline gets them because again, your muscles need
That was me.
more blood flow.
Yep, that was definitely me.
But it's interesting because I've had a couple of vascular specialists who have said, oh, if they tell me that they're going up a hill and it hurts when it's up a hill, but it doesn't hurt when it's flat, then I just say, no, it must be your lower back, because people who have lower back issues are more likely to have trouble and struggle with their calves and cramping going up a hill than someone with pads. Someone with pad would be cramping going on flat surfaces. But it sounds like that
I
that's not
never
the case,
cramped
because
on a flat surface. In fact, I begged for flat
interesting.
surfaces.
Yeah.
But we live on my farm is on a hill. And I mean, every day I had to feed cattle, I had to feed pigs, I had to feed horses every day. And I had to walk up and down hill to do that. And it was killing me.
Yeah.
And it just got to the point where finally we hired somebody to do chores for a while because I couldn't keep up.
Yeah, see, I'm glad you're saying this. I'm glad that Dr. Phillips, because I think that that's so important to actually, because the other wasn't really that logical. I could see how both could be issues, but you still, no matter what, you need to touch the patient. You need to feel those pulses. I always say it takes, 2 fingers and 2 seconds to save life and limb. It's just touch the
And,
patient.
and the same thing too, even if you're not sure that there's a blockage, an ABI, it's a simple, easy, cheap, highly sensitive, highly specific test. It's more sensitive and specific than mammograms, pap smears, a lot of other quote screening tests, and it's super
Right.
cheap. You can do it with a blood pressure cuff and a Doppler probe.
It's so
Yep.
easy. And 2 fingers.
In 2 seconds.
I went on AI, Google's AI yesterday, thanks to our YouTube producer, Josh. I think, no, it was actually X's, former Twitter, X's AI. And Josh
Wait, sorry to
said,
interrupt, but we have a YouTube channel.
we do,
Oh,
youtube.com/at the way to my heart. Make sure to like and subscribe. No, that was a shameless plug,
it
but
was.
we do need those likes and subscribes to further our message and to help save more lives and limbs. The more you like, the more you subscribe, the more the word gets out there. YouTube will push this video to help get more people to watch it, and hopefully we can inspire more people to get tested sooner and go to padtest.org, because there are a lot of primary care physicians and podiatrists that are now doing the testing in office using a technology by a company called Biomedics. And so we created padtest.org to make it easy and democratize access, so patients know when they're choosing a primary care or podiatrist that they have one that has the ABI test right there in office. But what I was, my initial point was on X with using their new AI functionality. I asked, how do you test for PAD? And one of them was literally just to take your stethoscope and listen for a bruit, which I hadn't really heard. In a bruit meaning turbulent flow, for those who don't know. And typically I usually say, check for a bruit with the stethoscope in the neck for the carotids and in the abdomen for a potential aneurysm in your aorta. But I'd never heard of taking your stethoscope and putting it on the legs to actually listen for that turbulent flow. Is that something that you have done?
No,
Or is that something that typically people do?
I mean,
I didn't think so.
I'm not the brewery thing. It's kind of a nice. It's a nice feature of the physical exam. I'm just speaking contemporarily now. We have much easier ways to assess for blockages, but honestly, feel for pulses, and if they're abnormal, begin a workup.
Exactly. And check for whether or not one foot's colder than the other.
Sure.
That could be a way.
100%.
And so I'm
Okay.
going to shift subjects because I want to know that, Susan, over the course of the 2 years that you were going through this, I would imagine you kind of had a little FUD syndrome, that you were starting to spiral south into maybe a depression. Like, is this in my head? What's going on?
Oh, that went through my mind too, that maybe, is it me? That, am I doing something that I shouldn't be doing? Why is all of a sudden this getting worse and worse and worse, and nobody seems to think it's important? And, I'm using a cane and I'm struggling to even sit on the doctor's table in the office, and nobody seemed to think that was unusual. And, I kept wondering, what have I done? And I will admit that did get to a point where I changed physicians. I still have my primary care, but I did not go to the physicians I had been seeing. I found a new spinal doctor. I found, new people to look after me. And the people that I found were wonderful, because the first thing they said, one of the things that was done for me, because the pain in my leg had gotten pretty significant. And he said, well, I can't get you into surgery right away, but I want you to go up and see pain control people, because I'm sure they can do something to help you. And they did. And they gave me a pill. And now I wish I could remember. Is it right here? It's basically used for pain. People have fibro pain, but
Yeah, I
they
mean,
gave
it's
me
often called gabapentin, Neurontin.
not those. It was another one. But what she did is she only gave me a very low dose, like the bottom 25 milligrams. And I was stunned at how much it improved my life while I was waiting those weeks for surgery. Did it take it away completely? No, but it let me sleep at night, and I could walk around a little better. And nobody had ever offered that.
So this was I'm refresh my memory. You were in preparation for spine surgery?
No, I was in preparation for my leg surgery, but I wasn't going to get in for 4 weeks.
Right.
So, and they sent me up to say, well, let's see what they can do in pain control for you.
Right.
In the meantime, because I told them how much it hurt. I said, I just can't walk without extreme pain.
Right.
And
see, this is my other frustration, that it takes long enough for the diagnosis. When someone's experiencing rest pain, which we didn't even get to that point, that she obviously had rest pain that was waking her up at night. That's advanced. That's CLI, correct, Dr. Phillips? When you have pain that's waking you up at night. So you'd think at that point, if someone's having that excruciating pain, if a doctor's ever felt this type of pain, you would think they would do everything in their power to get them in. Now, there are a lot of things that are beyond, as you know, a doctor's control. But if you can't get this patient in sooner, wouldn't you think someone would see if maybe one of their colleagues could get them in sooner on a calendar to get them out of pain? Because most of these patients end up in the emergency room.
Yeah, I will say though, like if her blockage was and is isolated to of the growing and in the pelvis, that rarely causes rest pain for an individual. And so maybe that's kind of where there was a little confused. Maybe there was some underlying another medical ailment that they thought might be involved, the back, etc. Really, the pain from blocked iliac arteries, which is above the groin, that's obviously with walking, and it's usually hip and buttock discomfort, sometimes lower back. But I've never seen anybody have rest pain with it, unless if it's acute.
So it might have been exacerbating, some of the fibromyalgia, which is why the actual medication worked.
It woke me up. I mean, I would move my leg just to get out of bed or to move in, and I would have thigh pain. All my pain was in my thigh, and it was miserable.
Yeah.
But the fact that the medicine worked, right, John? It might have been that,
and I think that
it was exacerbating the fibromyalgia.
Right. And then, again, it's unlikely. So some pain, like true pain narcotics can help, but I think there may have been a little confusion. But you're right, though. I mean, if someone has true rest pain, I mean, we do whatever we can to get them in, and we're often, we'll switch. If I need one of my partners to do it, they're more than happy to do it. And we that's how it works.
And it's always worth asking, is my whole point. And Douglas, do you want to jump in? I see you have a question for Susan.
Susan, it's great to have you with us. It's great to listen to your story. Uh, do I understand you were a nurse?
Yes.
Now, I was thinking how aggravating that must have been being a nurse and going through what you went through with what you know about being a nurse and dealing with the doctors in your professional life, and now you're having to deal with it in your personal life.
I got very frustrated, and then very frustrated with myself for not just taking my healthcare into my own hands instead of waiting for somebody else to take care of me. And I knew better. And I kept thinking they know more than I do, when in fact, you know your body better than anybody else. And if you're not getting what you need, you've got to go someplace and find somebody who will help you, which is what I did. I had to leave the group I was with and go to some other group where all of a sudden they paid attention to me. And it was hard to do that. And I'm driving quite a distance to get it done. I drive an hour and 20 minutes just one way to see the doctors I'm seeing now who got me fixed up. But I
So,
had to, if I'd listened to my primary care, I still wouldn't have surgery.
and as a nurse, and this is for you, Dr. Phillips, also, do these other symptoms masquerade the PAD symptoms? So, as a doctor, is it hard to distinguish between like fibromyalgia symptoms and PAD symptoms when you're just seeing somebody like for the first or second time?
So I'll clarify that for someone who's a specialist or who does this for a living, me, no. But for a primary care physician, potentially. But again, the physical exam.
Yeah, nobody ever took a pulse in my foot, ever,
And
until
so,
I saw a vascular
right.
surgeon.
And you would know that if the physical exam is abnormal, meaning the vascular exam is abnormal, then obviously you have a high degree of suspicion. Even if it's normal at rest and patient has risk factors, then you take the next step and you can do some non-invasive testing, those ABIs that I talked about. And we can get patients, we do them at rest, and then we put them on a treadmill, exercise the patient, and oftentimes the number drops down, which leads you to believe that there is a blockage that is causing symptoms to that patient. So you can tease this stuff out. But again, the eye sees what the mind knows. And if you're not looking for it, you're not going to see it.
Yeah. And that's really important. I think the moral of the story is really, you gotta ask your doctor, just say, hey, take off my socks, or you take off your socks and say, hey, I want you to touch my feet, feet, feel my pulses.
You have to ask for
feel
it.
the temperature. Yes, you do.
You do. Otherwise, they don't even undress you anymore. In any way, they listen to your heart through your clothes. They listen to your lungs through your clothes, and they pat you on the shoulder and send you on your way in the 5-minute appointment.
Well,
Oh,
and
my
again,
favorite.
that's a function. Sorry to interrupt real quick. That's a function of the medicine, 2025.
Yep. That's all the time they have.
And my favorite is the blood pressure, where they keep your hand down on your lap versus resting it up. And then they keep talking to you. And you're like, well, am I not supposed to keep my mouth shut during this and have my arm just resting on it?
Right.
I'm not sure. I mean, you're telling me now, suddenly my blood pressure is completely whacked out. And I'm like, well, let's try it this way. I'm coaching them on how to do it. And that's frustrating. But, it's one of those things where as we think we're going to be advancing towards televisits, right, as more mainstays in healthcare, I think this is a perfect example of where, what? I think we still need, especially high risk patients, to come in and you need to touch the patient.
Yeah, I would just say that honestly, the reimbursement for telehealth just went down to pre-COVID values. So it's less and less likely that we'll be doing telehealth. But the moral of the story is, number one, as a patient, you have to be an advocate for yourself. And that's just the reality of it. And number two, you have to, as a physician or clinician, provider, whatever, you have to examine that person.
And Susan, what are your final thoughts?
I certainly agree, because I know all of a sudden one day I just took my health care into my own hands instead of listening to other people, and said, I'm changing this. And I looked around and made a few calls and looked some people up and completely changed the group that I'm with. And
So
they're
Susan,
the ones that,
are you feeling better now? You had
oh,
this.
much. Oh, yes,
Are
it's
you
night and
cured?
day.
Are you cured?
It took me a while to bounce back from surgery because I'm not a young kid anymore. But you know, it took about, I would say, 5 or 6 days before I really walked with a full stride. But then the more I did it, the better it got, because I was so in the habit of guarding that it took me a while to get back to my regular stride because I had been guarding that leg so much. But after about 2 weeks, I was like, that's me. Hello. I'm still working on 12 steps. I can do 6 steps really well, but then the last 6 kind of I have to work at it. But I also think that's because I'm not fit anymore.
Well,
And
Um,
I'll just say that that intervention, that particular artery in that area, because it's so big, when it blocks, it causes significant problems in walking for the patient. But once we diagnose it and we treat it, it is life-changing for the patient. And those
oh, it
stents,
was.
unlike some of the other ones, they last a long time. So I'm glad you're
Yeah.
feeling better. I'm glad
Yeah.
and I'm,
I'm glad the piggies were saved.
Yep.
yes, and I'm wondering, in 20, I know 2020 hindsight, right? But and you don't know her medical history, but based on your experience, Dr. Phillips, let's just reverse back 2 years ago. And let's say 2 years ago, on the day where she presented with symptoms of potential PAD, the primary care physician felt the feet, noticed some diminished pulses, sent her, got her diagnosed with PAD, and she started a regimented walking program, and they mitigated any risk factors. Do you think that she might never have needed a procedure,
I
or
will
we
tell
might have
you,
delayed a procedure?
yeah, I will tell you procedures. So in that area, when that iliac artery is blocked, very rarely do they get better with, I mean, you can limp it along. Um, and the medicines that we often try don't typically work there. But because the stents work so well there and we have great therapeutic options, most folks need a procedure and they feel better and it lasts a lot longer as opposed to blockage maybe in the thigh and then obviously below the knee.
Yeah, that's good to know.
Yeah. I mean,
Well,
it
thank
really
you.
was night and day. It The next
Yeah.
day when I got up to walk, it was like, well, this is all right, isn't it? You know,
Congratulations.
thank
And
you.
Douglas wanted us to have some final thoughts in here too. Go ahead, Douglas.
So we've started a new year, Susan. I was wondering what your goals might be for this new year, and how you're looking forward to your new abilities.
I am dying to go out and walk, but right now the temperature is 17 and we have 4 inches of snow on the ground. And I live on the side of a hill. So I'm not doing a lot of outdoor work, which is where I'm the happiest. So I'm waiting for spring to come and let me get out there and walk, and start taking care of animals again, and start getting fit again. Because I think particularly over the last 6 months, I really lost what fitness I had as an older person.
Have you joined our walking program?
I have not yet. No. I want to, but at this point, I'm kind of screwed. There's just really no option except the mall, and the mall and I are not friends during flu season.
So we're gonna rain on your parade there, and I can
Okay.
see, Dr. Phillips biting at the bit here. He's gonna say the same thing. The moment you stop walking, you're gonna be that thing's gonna block right back up. You got to
Oh,
get
I'm
out and walk.
I'm
You got to
walking in
move.
my house all the
So
time, and
exactly,
I
I
bought
want to see you
I bought
moving.
a foot thing that where you sit in the chair and you walk, and I do 600 steps a day on that. But I can't get outside and really walk distance
Nope,
until
but
the
you
weather
distance
breaks.
doesn't matter.
Any
It's
movement
inside.
activity is good.
Exactly. Yep. Got to move, move, move. And we even have people in our group that will walk around the couch.
And you could continue Zumba too.
Oh yeah, you could do Zumba with the Zumba doctor. We recently interviewed the Zumba doctor, so you could even do that, and that would be really
I'll look
fun to do.
into it. I
Definitely. So
will.
there's always a reason. And as Douglas always says, Douglas was in our walking session. We have world-renowned walking therapy researcher of the year for the Global PAD Association, Dr. Chris Seenan, who comes on live on Wednesdays and answers questions for people who want to better understand exercise and walking as therapy in particular for PAD. And so he, talked about moving your feet on paper plates and doing the foot bicycle, but all of that is supplement to you just even walking around the house. Every commercial break for those 4 minutes, just walk around and walk around and walk around. Stay active as much as you can. And I love the fact that you do have one of those that when you're sitting down, that you're not necessarily sedentary while
No,
sitting.
I did that. I figured that out right away. And if this weather would break, I'm just dying in this cold weather. It's just not like that usually here.
Well, Susan,
Uh,
thank you so much for joining us on this
Thank you.
episode of Save My Piggies. We would love to hear your, in the future, how you're doing.
Yep.
And just, again, it's important that you maintain the fierce determination to be